Hello, Psych 101 students. Welcome to Module 7, Chapter 15, Learning Objective 7. We will look at how scientific evidence indicates which treatments are safe and effective. We'll talk about providers of treatment and also technology in treatment. So some treatments widely believed to be effective not only lack scientific support, but are actually counterproductive. It's scientific evidence that indicates which treatments are safe and effective. It is important to recognize the difference between evidence-based psychotherapies and fringe therapies. Evidence-based psychotherapies are interventions for specific disorders supported by high-quality scientific evidence. The only way to determine whether a treatment is valid is to conduct empirical research using randomized clinical trials. And this is what evidence-based psychotherapies are all about. They've been studied using randomized clinical trials. However, fringe or bogus therapies can gain a dedicated public following, even though there's no scientific evidence to support them. One example is rebirthing, which is a technique with no scientific basis. Some practitioners claim that rebirthing therapy can promote attachment and reduce traumas remaining from birth. However, there is no scientific evidence that rebirthing has any benefit, and yet it still gets used. And people pay money for it to go through these rebirthing procedures or rebirthing therapy. Three features characterize evidence-based psychological treatments. Number one is that treatments vary according to the particular psychological disorder and the client's specific symptoms. So it's not that, it's not a one-size-fits-all kind of deal. For example, if you go to a rebirthing clinic, you get rebirthing therapy, no matter what your disorder is or what your symptoms are. Okay. Number two is that the techniques used in these treatments have been developed in the laboratory by psychologists who have the proper expertise, education, and experience, especially behavioral, cognitive, and social psychologists. And three, no overall grand theory guides treatment. Instead, adoption of a specific treatment is based on the evidence of its effectiveness. And the evidence of its effectiveness comes from, once again, controlled, high-quality scientific research. Nearly half of all Americans meet Diagnostic and Statistical Manual, the DSM Criteria for psychological disorder at some point in their lives. In any given year, 25% of the population meets these criteria. So people, aren't really aware of how much disorder is actually out there. So, in any given year, about a quarter of the people in the United States would meet criteria for some kind of psychological disorder. Choosing the right treatment provider is extremely important for ensuring successful treatment. I mean, you wouldn't go to a foot doctor, for instance, if you had a heart problem, right? So you need a provider, that deals with your particular issues. So the professional must have the appropriate training and experience for the specific psychological disorder or life problem, and the person seeking help must believe the therapist is trustworthy and caring. A big part of therapy, of any kind of therapy, is establishing a relationship between the client and therapist. I mean, if you don't believe that the therapist can help you, and you don't believe that the therapy will work, then it certainly won't work. I mean, you have to kind of believe in the process, and that's kind of the first step in therapy is having the attitude that this therapy could help you. Medication is normally prescribed only by a psychiatrist who hold a medical degree. Efforts are underway to give more practitioners, such as clinical psychologists, the ability to prescribe medications. The most important features to look for in a provider are empathy and experience in the methods known to be effective in treating specific psychological disorders. Okay. This chart of psychological treatment providers is in your textbook on page 605. You are only responsible for knowing the first three rows. So clinical psychologist, psychiatrist, and counseling psychologist. You won't be asked about the last three. So let me go over them briefly here. Clinical psychologists either work with clients by providing therapy, or they conduct research on the effectiveness of various treatments. Psychiatrists tend to work in hospitals and treatment centers. They can prescribe psychotropic medications because a psychiatrist has a medical degree. Counseling psychologists treat clients' adjustment and life stress problems. So problems, that revolve around, perhaps schooling, academics or relationships in your life, or, something to do with your work, for instance, maybe going through a divorce, or, it's kind of, life stress problems. They work with these kind of things, but they do not treat psychological disorders. So you don't go to a counseling psychologist to have major depression to treat it, or OCD or schizophrenia, but they would help you get through problems in your life. And finally, technology in treatment. Let's take a look at that. There are new treatments that rely on smartphones, computer programs, or the internet to offer some form of psychological treatment. These treatments became especially important during the COVID-19 pandemic. They have been successful for a wide range of psychological disorders, including depression and anxiety. Research actually shows that they have been as effective as in-person psychotherapy when cognitive behavioral therapy is used. So this is, surprising to some that you can receive the same level and benefits of treatment doing it over a computer or a phone, or as doing it in person. And so this has kind of opened up the establishment's eyes to new forms of therapy that can be done using these new forms of technology. And that will conclude learning objective 7.